Hi, this is Rob Rotman, back in the studio. What a year. Today I would like to introduce Ryan McGraw and Michael Grice to talk primarily about the closing of Mercy Hospital. But let me start out with you, Ryan. What has it been like, at Access Living since the pandemic started?
Well, at Access Living since the middle of March, we have been working from home, and so pretty much when the pandemic subsides, which right now there is no sign of it subsiding, hopefully we can get back to work.
Right. So basically, I presume if people have a question, how should they get in touch with a staff member?
We have our phones numbers at work goes to our personal lines, so you can look up the staff you want to call and call their work number, and someone will get back to you if you call that number. But we are still working full time. We are a fully functional office. We're just doing it a little differently, working from home.
Mm-hmm. Great. Mike, I know what we really want to talk about today is the closing of Mercy Hospital. Where is Mercy Hospital located?
It's in the Hyde Park community.
Okay.
And there are a lot of residents with disabilities that really depend on Mercy Hospital for treatment and services.
Mm-hmm. And do you want to add something to that, Ryan? Or
yeah, so the exact location is 2525 South Michigan. So it serves the Bronzeville community and other communities, like Mike said, Hyde Park too.
And what other communities does Mercy Hospital serve?
So Mercy is a community that serves over 50,000 patients a year. It employs over 1,700 people. Over 80% of the population it serves is economically challenged, underprivileged, or uninsured. Many of the people that go to Mercy Hospital are on Medicare or Medicaid. And within the Mercy service area is 62% of Chicago's African American Black population and 37% of its brown or Latino population. So we really see here that Mercy Hospital serves across section of people.
And Mike, do many people with disabilities live in the communities which Mercy Hospital serves?
Yes, there are a wide range of uh, disability organizations that depend on Mercy Hospital for medical services, because that might be the closest hospital to those service organizations, and they have long-standing relationships with that hospital,
Right.
because no other hospital might not serve those individuals.
This, what would be the effects of the closing have on people with disabilities?
Well, I think number one is those residents as well as service providers are going to have problems with transportation and finding other doctors and hospitals to serve
Right.
those patients.
Ryan, do you want to add to that, or, I mean,
Yeah, I do. Just since 2018, 4 hospitals have closed on the south and west side of Chicago. This leaves really a healthcare desert in those communities. Mercy Hospital, the oldest hospital in Chicago, really serves anyone. Anyone can come in the doors. If you're uninsured, on Medicaid, on Medicare, no, like I said, 80% are disadvantaged. So the closing of the hospital would really hurt the community, not only, but many of those residents have disabilities and go to Mercy Hospital for their care. And if you take that away, you're putting someone at a disadvantage who may be uninsured with a disability, struggling to find medical care at hospitals that may not be so kind to you if you're uninsured or on Medicaid.
Mike, what do you feel about that?
And it's going to be a financial burden
Yeah,
for those parents
sure.
that live in that community that have children with disabilities. Because if they have to go to other hospitals, they're not going to be able to afford the care that their loved ones need.
Yeah.
Yeah, what has Mayor Lightfoot had to say about all this, or Mike, maybe you could address that?
To my knowledge, she hasn't talked about the closing of Mercy Hospital. But we really need to put it on the mayor's
Sure,
radar screen.
right,
We really want the mayor to speak out against this because we really wanted to support Mercy Hospital because she has said in the past that she supports black and brown communities and she needs to show that by giving them the health care that they need,
Right.
especially in the midst of the COVID-19.
Right. And isn't there more of a need now for, for Mercy Hospital in this whole pandemic?
Yes, I can say personally, because I lived in that community, that the closing of Mercy is going to be devastating to that community overall.
And I mean, what would happen? I mean, people would have to travel to the north side to get medical care.
And, like I said a few moments ago, it's going to be a financial burden
Right.
when parents have to figure out other ways
Right.
to get their loved ones
Right.
to different hospitals.
Right.
We know that over 40% of all COVID deaths are Black, and over 30% of COVID deaths are Latino.
Okay.
Meaning Mercy is most likely an important to their community in the midst of the pandemic.
Right.
How can you talk about closing this hospital in the midst of when we need
Right.
those that community, Black and brown people and people with disabilities who are disadvantaged already need that health care.
It's bad enough that there's a food
Yeah.
shortage. Now
Yeah.
we're talking about hospital
Yeah.
shortage.
Yeah. And do they just think people are just overnight go somewhere else or?
So it's really hard for that community
Sure.
to survive and strive.
Right. So what is the community really doing to help save the, and I guess this is the perfect show to both of you to address what can the community do and what can other groups do to help save Mercy Hospital?
Well, a lot of community organizations that organize doctors and nurses, and other organizations have come and spoke out about this. There has been actions and press conferences both in front of Mercy downtown at the Thompson Center, really calling on leaders to
Right.
do something about this, to stop the closure. And definitely, like SEIU is a part of this, the Kenwood Oakland Community Organization, Journey for Justice. So a lot of Black and brown leaders in those communities have spoken out about this, and now we need the city and the state to take action.
And is there anything being done by the city or the state, or do you think they're just turning a deaf ear?
They just turned a deaf ear, but from the consumer perspective, if consumers are able, they should contact their legislators and put as much pressure on their legislators regarding this issue
Right. And
as possible.
right. Yeah, go on, please.
They also can contact the governor about this and say how it will affect them.
Right.
And also, the, the, the governor has said that during veto session in March, legislatures will discuss how to fund Mercy Hospital and giving funding to Mercy Hospital. I mean, this is a result of a merger of a few hospitals that were supposed to happen. Of
That didn't happen.
$520 million merger that didn't happen.
Sure.
And that is why we are in this crisis. However, we want everyone to understand that this is about people over profit.
Right.
And when you take a safety net hospital,
Right.
that is really a safety net to people,
Right.
you affect that whole community in a devastating
Right.
way.
Right. Mike, when you were a consumer at Mercy, what was your experience like? I mean,
Well, it was, good and bad.
yeah, sure.
The bad side is that Mercy doesn't have all the modern
Wow.
equipment
Wow.
that they really need to do
Wow. Sure.
patient care.
Wow.
But they do the best they can with what they have.
Yeah. See. And how long ago was that?
Oh, this was way over 10 years ago.
Wow. So, wow. Interesting. You would think, I mean, like they're near, what, are they near the University of Chicago?
Actually, not too far.
Yeah, I mean, you would think you're near one of the, the most incredible universities in the world, and yet, they would be that behind and everything, So what else would you guys like to mention then?
I've always said this about healthcare. It should be a human right, but in this country, it's not. It's
Right.
based on the amount of money that you have.
Mm-hmm.
If you have money
Yeah.
to pay for healthcare, then you can get the healthcare that
Right.
you need. If you don't, you're just a number
Right. Mm-hmm.
in a system.
Yeah. What are your feelings, Ryan?
Yeah, I agree with what Mike said in that we really need to save Mercy Hospital so a whole community of people are not left without health care. And to get involved, please call your legislature and call the governor and tell them to save Mercy
Right.
because that is the only way this will get done.
Right.
And
Right. So put pressure on and everything.
Patients with disabilities can't get physical therapy, they
Wow.
can't get occupational therapy,
Wow.
they can't get speech therapy. So it affects the entire family.
Wow.
This closing does.
Yeah.
yeah, critical needs and specialized care. That, I mean, they have said that they will be offering outpatient clinic, with significantly less services, but that is not okay.
Yeah, yeah.
Any cutback on health care in that area is just not right. So,
Okay, well, thank you both very much for coming, and we'll keep watching this and everything, and maybe we can take a camera down and just shoot there, and people can really see the situation. Do either of you have any other things to say, or?
no, thank you for having us on, Rob.
And Mike, we've been at this a long time. Do you think we're going forward or backward, or?
You know, it seems like to me that we're taking steps backwards instead of going forward.
Right. Okay, well, thank you both very much, and lean on, or what did Justin Dart Jr. always say? Lead on, I believe. So I guess power to the people.
Power to the people.
Thank you. Hi, this is Rob Rotman again. As many of you may know, we lost William Owens Jr. this year. What I loved about William was he was so dedicated to access living, to adapt into the single payer coalition. William was there to stuff envelopes, set up chairs. I really think the Arts and Living Cabaret at Access Living were so wonderful with all the help William and Curtis Harris did to make it a great event. William had such a joy about himself. His faith was so real. It meant the world to me when he said, "Rob, I pray for you and your family." My dear friend Jason Stanek always said that he always thought he was Martin Luther King Jr.'s twin. And I always felt William looked like he was Louis Satchmo Armstrong's long-lost son or brother. William, we will miss you so much. You truly made this a wonderful world. Now you're watching over us. To quote a lyric from the show Ragtime, the best show I have seen in this city. Make them hear you. When they hear you, I'll be near you again. William, we know you'll always be near us to make the disability community live in a more accessible and caring world. Lead on, bro. Thank you.